Today's lesson is on diabetes mellitus. It's the last of our non-communicable diseases for discussion. It is the 7th leading cause of death in the United States. Insulin. Insulin is a hormone produced by the pancreas that is required by the body for the metabolism of carbohydrates. Insulin is produced by your pancreas. Diabetes is a disease in which the pancreas fails to produce enough insulin or the body fails to use insulin effectively. There are 3 types of diabetes. There is type 1 diabetes, type 2 diabetes, and then there is gestational diabetes. Type 1 diabetes, also known as juvenile diabetes. With type 1 diabetics, they are typically insulin dependent. A very small percentage of the cases of diabetes are type 1. 5 to 10% of all diabetes cases are type 1 diabetes. It's an autoimmune disease in which the immune system destroys the insulin-making cells. Typically, they must depend on insulin injections or oral medications for the rest of their lives. Type 1 risk factors. Family history of type 1 diabetes. Certain races and ethnicities are at greater risk for type 1 diabetes. Some viral infections as well as environmental toxins. Type 2 diabetes is much more common. It is on the rise, and it is one of the reasons that the cases of diabetes for the general population has increased so dramatically. It is also known as adult onset diabetes. It typically doesn't happen until we're older. However, with the obesity issue that we have, we see it affecting younger and younger people. It is non-insulin dependent diabetes, and it is 90 to 95% of all the cases of diabetes. So the majority of people that have diabetes have type 2 diabetes. With this, the insulin production is either deficient or the body is unable to utilize the available insulin. Henceforth, what we find is we have many pre-diabetics. They aren't quite a diabetic, but they have all the conditions and numbers that would make us believe that they are pre-diabetic. So if people would change their lifestyle, lose weight, exercise, eat more healthy, they often can avoid oral medication. Some of the risk factors for type 2 diabetes. The first and foremost is obesity. With the ever-growing problem of obesity in this country, we see the number of diabetic cases rising at a rapid rate. The second most common risk factor is age. The older we get, the more risk we are at. Physical activity or being sedentary, a family history of diabetes, and again, certain races and ethnicities are at higher risk of type 2 diabetes than others. Gestational diabetes is the last kind of diabetes. It's the kind of diabetes that sometimes women develop during pregnancy. It only affects 2 to 5% of all pregnant women, and it usually disappears after the baby is born. This leaves women with a greater risk of developing type 2 diabetes, though, later in life. Some of the complications of diabetes. Heart disease and stroke. It makes us wonder as we look at the general population's leading causes of death in the United States, heart disease being number 1 and diabetes being number 7. It makes us wonder then, is it really number 1, or should diabetes be higher on the chart than number 7? 65% of the deaths due to heart disease and stroke, the patient had diabetes also. 73% of the people with diabetes also have high blood pressure. It is the leading cause of new cases of blindness among 20 to 7-year-olds. Kidney disease, it is the leading cause of treated end-stage renal disease. And 60% to 70% of the people that have diabetes also have nervous system damage. More than 60% of non-traumatic lower limb amputations are due to diabetes. Oftentimes it could take a foot, a toe, the lower leg, etc. Periodontal disease is more common in diabetics. There are pregnancy complications if the diabetes is not controlled, with birth defects, spontaneous abortions, and babies that are very large when they're born. Sexual dysfunction. Men are 2 times as likely to experience erectile dysfunction, and it makes them also much more susceptible to other illnesses like pneumonia, the flu, etc. On your screen, you'll see some of the symptoms of diabetes. Frequent urination, excessive thirst, extreme hunger, unusual weight loss, increased fatigue, seem to be tired all the time, irritability, as well as blurry vision. The chart you'll see in front of you are for the fasting plasma glucose test on the left and the oral glucose tolerance test on the right. You'll notice the difference in the numbers. With the fasting, it means that you didn't eat or drink anything 12 hours prior to this blood test. For a normal range, your blood glucose levels would be 100 milligrams or less. If you are in the pre-diabetes mode, your numbers would be between 100 and 126. And if they were going to diagnose you with diabetes, your numbers would be 126 or higher. You'll notice the difference between the oral glucose over here on the right and the fasting glucose on the left. The numbers are much higher for the oral glucose, knowing that you haven't fasted before this test. So normal is 140 or below, pre-diabetes is 140 to 200, and diabetes would be above 200. The treatment or controlling of diabetes, probably one of the most important things, is education. Some people need to be educated as well on the insulin injections or pump, oral medications for some. Diet and exercise is important for all diabetics, whether you have type 1, type 2, or gestational diabetes. Weight management, again, for all diabetics, as well as regular checkups. We can see how diabetes has risen in this graph on the left. In 1980, there were less than 6 million cases of diabetics. By the year 2005, we were at almost 16 million diabetics. When we look at the cost of diabetes on our society, it's around $174 billion a year. The direct medical costs for hospitalizations, medications, checkups for eye care, foot care, oral health, run around $116 billion a year. The indirect costs, the ones that cause people to be disabled, unable to work, die prematurely, are about $58 billion. If you would like more information on diabetes, you can go to the American Diabetes Association. You could go to the Centers for Disease Control and Prevention, as well as the National Diabetes Information Clearinghouse. If you need to pause this video at any time, you may do so. You may rewind so that you can complete your guided notes for this unit. Any questions, please see me.